Private Darren McCallum served in East Timor for 6 months in 2007 and has just returned from 4 months in Afghanistan. The 23-year-old says he was forced into another battle within days of getting home. He was admitted to a mental health ward after a late-night confrontation with police under an involuntary treatment order that involved the military police as well. He says there should have been more support.
Instead, I got locked up in a mental ward and I was drugged up on Valium and all sorts of drugs.
Private McCallum says many soldiers are returning home from active service and turning to drugs and alcohol to deal with their demons.
A lot of guys do fall between the cracks and a lot of guys don't talk about the issues to anyone. They just bottle it up and they find other ways to deal with it, drinking alcohol, etc.
The Queensland branch of the Australian Medical Association says about 20% of returned servicemen have post-traumatic stress disorder, and that can trigger substance abuse.
The very nature of the theatre of war is conducive to substance abuse, and so we certainly see much higher incidence.
Retired Brigadier Neil Week says the number of overseas deployments undertaken by modern soldiers compounds the stress of combat and coming home.
A lot of soldiers don't like admitting that they're being affected by it. It's this peer pressure, they want to be as good as the next mate. They don't want to indicate to their wife or to their mates that last night they had a real nightmare.
The Defence Force says it has no evidence to support claims that there's increasing drug use amongst returned service personnel, but has ordered a major study into the mental health of soldiers next year. Megan Woodward, ABC News, Townsville.